Here are 4 things to know if you're dealing with thin endometrial lining and infertility issues. Number 1, your period gives you clues that you should then investigate. If you have really scanty light periods, a very, very short flow, only dark, old-looking period blood, or you skip periods altogether, these are definitely useful clues that your lining might be thin or not building up and cycling as it should. In my 90-day program, I have an entire series of, wait for it, flow charts to take you through all sorts of various signs and symptoms, from your period blood color, quantity and duration, to cramps and clots, to your overall cycle length, and so much more. If you want to know the most likely causes for all sorts of variations and changes, and also what's normal, you should definitely sign up for my full program. That said, if you have an educated guess that your lining might be lacking some way, you can't really know for sure until you confirm it with a test. And for thin lining, this means getting an ultrasound, which can just measure the lining thickness, or way better still, something like a saline-infused sonogram, which is SIS, which is an ultrasound where they insert a catheter and put a little saline fluid into the uterus to expand it a bit. Then they can more clearly see the edges of the lining and measure it, which can show the thickness and if you've got things like polyps and fibroids in your uterus too. Now, there are also scopes that can let your doctor take a look around and look for scar tissue and those physical changes I just mentioned, so talk with your care provider. The main takeaway here is that your period is going to give you important clues, and you should then take that info and ask your doctor to look and see if you're right and go from there. Number 2, iron and blood building can help. Some people think that having a really heavy period flow and losing lots of period blood is going to make you anemic, which is fancy for blood deficient. But studies actually suggest that the opposite is true, that having a heavy period flow is a reliable indication that a person is not anemic and has a thicker lining, or more technically, that they have higher hemoglobin and red blood cell or erythrocyte counts than people with thin linings and lighter flows. Now, this means if you have a thin lining or scanty period flow, you might work on building up your lining by building up your hemoglobin and your red blood cell count. And you can do this through diet and through supplementation. Cooking in cast iron pans, eating dark leafy greens, including high-quality hormone-free red meats and fish, nuts, and some soy can all be helpful. Iron supplementation might also be useful. I personally prefer plant-based liquid iron or melt-away iron tablets, which are often marketed for people who have had bariatric surgeries. But I like these forms for all people because both of them are way easier to digest and absorb than regular iron pills, and they're less likely to make you constipated and feel miserable too. A good iron supplement should also include things like vitamin C, A, or beta carotene too, because these things help your body absorb and actually use the iron. 2 really important safety notes on taking iron supplements. Number 1, some bodies actually have too much iron. It can be from overdoing it on supplements or from a condition called hemochromatosis, which is actually fairly common. So you should chat with your care provider and not overdo it if you decide to take supplements. More is definitely not better. 2, iron poisoning in young children is a real danger and usually happens when kiddos think iron pills are candy or liquid iron is juice. So be sure to talk with them and use child safety measures if you have kids in your house. Number 3, electrostim acupuncture can help. There are some really lovely studies that show how electrostimulation with acupuncture can improve something called the uterine artery pulsatility index, and that is just fancy for the measurement of the blood flow through the vessels that go directly to the ovaries and to the uterus. Now, the best known study about this even showed that these treatments can improve this blood flow for 10 to 14 days after the treatment. A 2019 meta-analysis showed a statistically significant improvement in not only lining thickness with electrostim acupuncture, but also an increase in the number of people with trilinear endometrial patterns and improved embryo transfer success rates and live birth rates both. As I'm filming, an even better study is looking at whether acupuncture with electrostim specifically improves not only the thickness, but receptivity levels, because these prior but less well-designed studies seem to suggest that that's the case. Some IVF clinics even prescribe acupuncture and electrostim treatments once or twice a week for 8 to 12 sessions before transfers for people who have had lining issues in past cycles. I teach some of the points that we use in my YouTube acupressure series. My video that's called Acupressure for Pelvic Circulation is a particularly good thing for thin linings. Adding electrostim acupuncture, of course, or using a TENS machine, which is a device like this that I also have a video about on this channel, can also be useful, especially if you can't get acupuncture. Check those videos out too. Number 4, changing your IVF protocol might help. Last but not least, if you're doing IVF, or more specifically a frozen embryo transfer, that's an FET, it is definitely worth noting that not all protocols work the same in all bodies when it comes to lining outcomes. Many clinics prefer to use a pretty standard FET protocol that goes something like this. You shut down your ovaries and suppress your own menstrual cycle with something like Lupron or birth control pills. Then you add some lab-made estrogen that ramps up over a couple of weeks. This estrogen can be in the form of pills, suppositories, patches, and even shots. The estrogen should give the signal to the endometrial lining to start to thicken up. As those estrogen levels go up, 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 the lining should also be getting thicker and thicker and thicker. Once the lining is where your clinic wants it to be, the current research says 7 millimeters is the minimum for the best FET outcomes. Then they have you start to add progesterone, which actually compacts the lining down a little bit, but sort of locks it in and keeps it stable and tells it to get ready for implantation. Here's the problem for some bodies. Estrogen is energetically like heavy, cold, thick, dense goop. And some bodies don't process massive amounts of lab-derived estrogen like we want them to. Instead of making a thick, lush lining, they make thin lining, endometrial fluid, abdominal bloating, nausea, fatigue, and even vomiting. Now, this is most likely if you're taking oral estrogen, so switching to patches or suppositories can be enough to help some people's bodies. If that's not enough, then using injections can be even better. But with some bodies, no matter what form of outside estrogen you use, it's cycle after cycle after cycle of thin lining and feeling miserable and let down. These people are prime candidates for using their body's own estrogen by doing something like a natural FET prep protocol or a minimal stimulation FET protocol. Now, in both of these cases, the ovaries are not shut down ahead of time, and they're allowed to put out their own estrogen, which bodies that don't do well with lab-made estrogen tend to like a whole lot better. I have personally seen many people get their FETs canceled over and over again, and if and when their doctor agrees to do a natural or a stim FET, they often do a ton better. One person I worked with recently had 6 cycles canceled back to back. Her lining never got above 5 millimeters. Her doctor said she might want to consider surrogacy, and she asked him to just do an ultrasound during her totally unmedicated, in-between trying menstrual cycles. And lo and behold, on nothing besides what her ovaries were doing themselves naturally, she had an 8 millimeter lining. They caught it in time and started her on progesterone and turned that cycle into a transfer, and she has a son from that cycle. Now, clinics often don't start with these kind of cycles because honestly, they're harder to manage and control. They're more monitoring, they're more work for everyone, more running around for you. And also, honestly, most bodies will do fine on the regular starter protocols. But for those bodies who don't, it's really something to discuss with your doctor and ask about. I have got so much more education about lining and cycles and self-advocacy in my 90-day program. So if you're the kind of person that likes this sort of evidence-based info, go check that out. I would love to have you in the Baby You Want community. I hope this video helps you feel much more empowered and gives you ideas to improve your lining if you need to. As always, remember, I'm out in the world cheering you on, and thank you so much for hitting play. I'll see you again soon. Maybe if I have the thing and I'm not thinking about, oh my God, I don't have the thing.